Okay, here we have a fractured carnasal. This is 208, one of the chewing or shearing teeth. Most common tooth that I see broken because this is a shearing tooth, as in it works like scissors with this other one. So they put something hard in here and snap it. This one has a bunch of plaque over it, but if I compare it to the other side, I'll see there's just a lot less tooth here. It's not super obvious if you don't know what you're looking for, but if you don't think it looks right, compare the other side and bring them in to find out. But I can probe way down in here when I've got them out. You obviously can't do that when they're awake. And when I say complicated crown fracture, I mean that we have broken down into the pulp chamber, which you can't really see because of all this plaque, but that's what all this is right here. It's the living part of the tooth. And once we have exposure to that, at some point, bacteria is going to ascend and cause endodontic infection, i.e. infection at the tip of the root. Which we'll often see on x-rays. Might take a long time for that to happen. Might happen in weeks, might happen in years, but it's going to happen. And when it does, sometimes, not always, in fact, not all that frequently, we will see a draining tract, usually right at this area. This one is this red spot right here. I saw an exam, and I said, that's probably a draining tract. And now that I've got the dog out, I can slip that probe right down in there, and the tip of that root is right down in there someplace. These will often happen right here at the gum line, and it's important to know what these look like, because while it isn't always a draining tract, if you see something like that, you can see something like that, and the tooth itself looks perfectly normal. You wouldn't even suspect that there's anything wrong with it. But if you see that, there's probably endodontic disease, and they absolutely need x-rays to find out if that's what's going on or not. This tooth's coming out. This dog will be happy, won't miss that tooth at all. March on.